7 things that can save your life in a heart attack alone. Imagine you are alone at home, at work, or even driving. The day seems normal, but suddenly, a strange pain starts in your chest. Breathing becomes short, cold sweat runs down the body, and a feeling of heaviness dominates the center of the chest. Within seconds, fear arises. Am I having a heart attack? And now, what to do? How to act when every second can be the difference between life and death? Knowing how to recognize the signs of a heart attack and act correctly can save not only your life, but also that of someone close to you. The problem is that few people know the crucial information that can make all the difference in an emergency. In this guide, you will learn everything you need to know, the signs, what to do, and the mistakes you should never make. Let's get started. What causes a migration? A heart attack is caused by an interruption in the flow of blood to the heart. This blockage occurs most of the time due to the formation of a clot in a coronary artery, the vessels that carry oxygen and nutrients to the heart muscle. Without oxygen, heart cells begin to die within minutes, resulting in severe damage to the organ. The main reason for this blockage is atherosclerosis, a process in which fatty plaques, cholesterol, and other substances accumulate on the walls of the arteries. Over time, these plaques can rupture, triggering the formation of clots that obstruct blood flow. Factors that contribute to atherosclerosis and consequently heart attack include 1. Bad food. A diet rich in saturated fats, trans fats, sugar and salt increases bad cholesterol, LDL, and favors the accumulation of plaque in the arteries. 2. Lack of exercises. A sedentary lifestyle impairs circulation, increases the risk of hypertension, and contributes to weight gain, all factors that compromise the heart. 3. Smoking cigarettes are one of the biggest causes of heart health. It causes inflammation in the arteries, favoring the formation of plaques and clots. 4. Diabetes and hypertension. Both conditions accelerate the process of atherosclerosis. Diabetes, in particular, can also mask the symptoms of a heart attack, making early diagnosis difficult. 5. Stress. Chronic stress increases the production of hormones such as adrenaline and cortisol, which strain the heart and raise blood pressure. Furthermore, genetic factors play an important role. If you have close relatives who have already suffered a heart attack, your chances of facing the same problem are greater. Another alarming fact, even people considered healthy can suffer a heart attack. This occurs due to sudden spasms in the coronary arteries, which can block blood flow, or extreme stress situations which strain the heart. Did you know that 50% of deaths from heart attacks occur within the first hour after symptoms appear? Therefore, knowing the warning signs is essential. We will explore what these signs are in the next topic. Infarction warning signs. Recognizing the signs of a heart attack can save lives, but many are still unaware of the symptoms beyond chest pain. The problem is that the body emits different alerts, which can be confused with minor problems. Knowing how to identify them quickly is the key to taking action before it is too late. Here are the 7 most common signs that indicate a possible heart attack. 1. Chest pain. This is the most classic symptom. The pain is often described as a tightness or crushing sensation in the center of the chest, as if something very heavy is pressing down on the area. It can radiate to the arms, jaw, neck, or back. Unlike temporary pain, this pain persists for more than 5 minutes and does not improve with rest. 2. Intense sweating and palaty cold, sticky sweat accompanied by paleness is one of the first warning signs. It occurs due to the release of adrenaline by the body, which tries to compensate for the cardiovascular emergency. 3. Shortness of breath. Shortness of breath or a feeling of suffocation can happen even without chest pain. This is caused by the heart's difficulty pumping blood properly, which reduces the oxygen available in the body. 4. Dizziness or feeling of fainting. Dizziness occurs due to a sudden drop in blood pressure or a decrease in blood flow to the brain. It is often accompanied by blurred vision or mental confusion. 5. Nausea and vomiting. These symptoms, common especially in women and diabetics, are often confused with stomach problems. They may arise due to irritation of the vagus nerve, which connects the heart to the digestive system. 6. Numbness or heaviness in the arm. The most common thing is to feel discomfort in the left arm, but this can also occur in the right arm, shoulders, hands, or even both arms at the same time. This symptom is a result of the brain interpreting pain signals in the heart as if they were coming from the arms. 7. extreme anxiety, or a feeling of imminent doom. This is a frequent description of patients. They report intense fear as if something very bad is about to happen. This sensation is a reflection of the body given the gravity of the situation. Attention to special groups. Women and diabetics may experience atypical symptoms such as just nausea, extreme tiredness, or mild chest pain. These signs are often underestimated, leading to late diagnoses. If you notice one or more of these symptoms, the next step is to act quickly. But what can you do to increase your chances of survival? Find out in the next topic. The first things you must do to survive. If you recognize the signs of a heart attack, it is essential to act immediately. Every second counts, and what you do in the first few minutes could be the difference between life and death. Here's a step-by-step guide on what to do. 1. Call SAMU immediately. The first thing to do is ask for help. Call the emergency number and state your symptoms clearly. If possible, keep your phone nearby and turn on speakerphone to save power. Explain that you may be having a heart attack and follow the attendant's instructions. If you are in an area where SAMU may take more than 15 minutes, seek help from neighbors, family members, or ask for quick transportation, such as a taxi or ride-sharing app. Never drive alone. 2. Keep calm and save energy. Although it is difficult, try to remain calm. Stress increases the load on the heart and can worsen the condition. Sit or lie down in a comfortable position, with your back supported and your head elevated. This facilitates blood circulation and reduces the risk of falling if you lose consciousness. Avoid moving around or performing unnecessary tasks. The objective is to save the heart's effort until help arrives. 3. Chew aspirin, if available. If you have aspirin, as at home, and are not allergic, chew 2 to 3 100 milligrams tablets. Chewing is important as it speeds up the absorption of the medicine, allowing it to act faster in the blood. Aspirin acts as an anticoagulant, helping to prevent the clot from getting bigger and causing further damage to the heart. 4. Avoid driving or traveling alone. While it may seem tempting to get in your car and drive to the hospital, doing so can be extremely dangerous. During a heart attack, blood pressure can drop sharply, or serious arrhythmias can lead to fainting. Driving in these conditions not only puts your life at risk, but also the lives of other people on the road. 5. Follow the instructions of the SAMU attendant. The emergency responder can provide specific guidance while you wait for help. Be attentive and follow all recommendations. Important positioning. While waiting for the ambulance to arrive, keep the doors unlocked to facilitate access for rescuers. If you have pets, place them in a separate room to avoid distractions or complications during care. What to do if you feel worse. If symptoms worsen before help arrives, remain still and continue breathing slowly and controlled. Remember that every minute that passes without treatment increases the risk of irreversible damage to the heart. Acting calmly and following these steps can greatly increase your chances of survival. But just as important as knowing what to do is knowing what should not be done, to avoid fatal mistakes. What not to do during a migration. Knowing what to do during a heart attack is essential, but avoiding common mistakes can also save lives. There are attitudes that, although they may seem harmless, can worsen the situation and put your survival at risk. Here's what you should never do. 1. Don't ignore the symptoms. Underestimating warning signs such as chest pain, shortness of breath, or dizziness can be a fatal mistake. Many people attribute these symptoms to minor problems, such as tiredness or indigestion, and hope they pass. However, every minute counts during a heart attack, and delaying medical care significantly reduces the chances of survival. 2. Do not drive to the hospital alone. As tempting as it may be to get in the car and go to the hospital, this decision can be extremely dangerous. During a heart attack, it is common for pressure drops or serious arrhythmias to occur, which can lead to fainting. If this happens while you are behind the wheel, the risk of serious accidents increases dramatically. 3. Do not self-medicate with vasodilators. Medications such as Isordil and Sustrate, used to dilate arteries, can be dangerous if taken without medical advice. They can cause a sudden drop in blood pressure, worsening the situation. Furthermore, if you have consumed erectile dysfunction medications such as Viagra, the risk of fatal side effects increases. 4. Don't believe in myths like coughing to restart your heart. One of the most widespread myths is that coughing vigorously can help restore blood flow or restart the heart during a heart attack. This has no scientific basis and can even make the situation worse, increasing physical effort and strain on the heart. 5. Do not make unnecessary physical efforts. If you are alone, avoid tasks that require effort, such as walking to another room or trying to carry out activities. The goal is to save energy and reduce the burden on the heart until help arrives. Important care during infarction. Desperation often leads people to make hasty decisions, such as insisting on solving the problem on their own. Remember, a heart attack is a medical emergency and requires specialized care. Avoiding these mistakes is as important as acting correctly. But what if you are near someone who is having a heart attack? In the next topic, we will see how to help someone else in this critical situation. How to help someone with a heart attack. Being there when someone is having a heart attack is a huge responsibility, but your actions can make all the difference between life and death. Knowing how to act correctly is essential to increase a person's chances of survival. Here are the most important steps. 1. Call SAMU immediately, 192. The first step is to call the emergency service. Explain the situation in detail, describing the symptoms the person is experiencing. For example, report if there is chest pain, shortness of breath, sweating, or loss of consciousness. The more information you provide, the better support SAMU can offer. 2. Help people keep calm. A heart attack can be scary, and panic only makes the situation worse. Talk to the person. Ask them to breathe slowly and deeply. This helps reduce anxiety and reduces the burden on the heart. 3. Position the person properly. If the person is conscious, help them sit or lie down in a comfortable position with their back supported and their head slightly elevated. This position improves blood flow and prevents falls if she loses consciousness. 4. Offer aspirin if available. If the person is not allergic and can chew, offer 2 100 mg aspirin tablets. It is important that aspirin is chewed, as this speeds up its absorption in the body, helping to prevent the formation of clots. 5. Be prepared for CPR, cardiopulmonary resuscitation. If the person loses consciousness and is not breathing, it is time to act quickly. Place your hands in the center of the person's chest and begin chest compressions. Compressions should be firm and done at a rate of 100 to 120 per minute, like the rhythm of the song Stayin' Alive by the Bee Gees. Continue until help arrives. What not to do when helping someone. Although the intention is to help, some attitudes can be harmful. Do not give the person liquids or food. Do not try to move it unnecessarily unless it is to put it in a more comfortable position. Avoid unproven methods such as trying to make her cough or patting her on the back. Why are your actions so important? Studies show that a quick response to a heart attack can double or even triple the chances of survival. Early cardiac massage, for example, maintains blood flow until a defibrillator arrives, essential to restore normal heart rhythm. Knowing what to do in a critical situation not only saves lives, it can also make you an unexpected hero. But what about when the symptoms are different, as in cases of heart attack in women? We will explore this in the next topic, differences between mind in men and women. Although heart attack is a cardiovascular problem that affects both men and women, symptoms can vary significantly between the two groups. These differences make diagnosis more difficult in women, often delaying treatment and increasing the risk of serious complications. The classic signs in men. In men, a heart attack usually presents the classic symptoms: severe chest pain described as squeezing or crushing, radiation of pain to the left arm, back, neck, or jaw, intense sweating accompanied by shortness of breath and palpitations, fainting or dizziness in more serious cases. These symptoms are widely recognized and often associated with heart attacks, which facilitates early diagnosis in men. The most common signs in women. In women, the symptoms can be more subtle and less evident, which means that many do not recognize that they are having a heart attack. The most common signs include extreme or unexplained tiredness, which may appear days before the heart attack. Nausea, vomiting, or stomach discomfort, often confused with gastric problems. Mild pain in the chest, which can be interpreted as muscle pain. Pain in the neck, jaw, shoulders, or upper back instead of the classic chest pain. Feeling of shortness of breath, even at rest. Why do women show different symptoms? These differences occur because women are more likely to suffer non-obstructive heart attacks, that is, those caused by spasms in the coronary arteries or the formation of small clots, and not necessarily by the complete blockage of a larger artery. Furthermore, hormonal factors also play an important role. Before menopause, higher estrogen levels in women offer some protection against cardiovascular disease. However, after menopause, the risk of heart attack increases significantly. The challenges of diagnosis in women. Unfortunately, atypical symptoms often lead women to delay seeking medical help, believing it is something less serious. This is a serious problem, as delay in care reduces the chances of survival and increases damage to the heart. The importance of knowing the signs. Both men and women should be aware of warning signs and seek help immediately if they notice something wrong. In the case of women, it is essential to emphasize that symptoms such as extreme tiredness or unusual discomfort can be as serious as chest pain. Recognizing these differences saves lives, and, to further reduce the risk of heart attack, there are preventative measures that we can all adopt. We will explore them in the next topic. Exercises and daily habits that strengthen the heart. Preventing a heart attack is much more effective than treating the consequences. Adopting a healthy lifestyle not only strengthens your heart, but also significantly reduces your risk of cardiovascular disease. Here are the most important habits to keep your heart in top shape. 1. Practice physical exercises regularly. Physical activity is one of the most effective ways to strengthen the heart and improve blood circulation. Aerobic exercise such as walking, running, cycling, or swimming helps reduce blood pressure, control cholesterol, and improve the overall health of the cardiovascular system. The ideal is to perform at least 150 minutes of moderate physical activity per week, such as brisk walking, or 75 minutes of intense activity such as running. Even small changes, like taking the stairs instead of the elevator or walking to work, can make a big difference. 2. Adopt a balanced diet. What you eat has a direct impact on your heart health. Prioritize foods rich in fiber such as fruits, vegetables, and whole grains, and consume healthy fats, present in olive oil, avocado, and fish rich in omega-3, such as salmon and sardines. Reduce consumption of saturated and trans fats, which increase bad cholesterol, LDL, salt, which can raise blood pressure, added sugars, which contribute to obesity and diabetes. Including functional foods such as nuts, chestnuts, and chia seeds is also a great way to protect your heart. 3. Maintain a healthy weight. Excess weight puts a strain on the heart and increases the risk of high blood pressure, diabetes, and high cholesterol. Working to achieve a healthy weight by combining diet and exercise is one of the most important steps to heart health. 4. Avoid cigarettes and excessive alcohol. Smoking is one of the biggest villains for the heart, causing damage to the arteries and increasing the risk of clots. Excessive alcohol consumption can raise blood pressure and cause arrhythmias. If you smoke, seek help to quit. And, regarding alcohol, limit consumption to a maximum of 1 drink per day for women and 2 for men. 5. Manage stress and prioritize sleep. Chronic stress elevates adrenaline and cortisol levels, which put a strain on the heart. Practices such as meditation, yoga, breathing exercises, or relaxing hobbies can help reduce stress. Furthermore, quality sleep is essential for heart health. Sleeping less than 6 hours a night increases your risk of high blood pressure and other cardiovascular problems. Small changes, big results. It's not necessary to change everything at once. Small adjustments to your routine, such as including a 30-minute walk or swapping processed foods for natural options, already bring significant benefits. These habits, when maintained over the long term, not only prevent heart attacks, but also improve your overall quality of life. But even with prevention, time is crucial during a heart attack. In the next topic, we'll look at why acting quickly can save your life. Why time is crucial during a MIRACT. When it comes to a heart attack, time is literally life. With every minute that passes, the heart suffers irreversible damage, and the chances of survival decrease. Understanding the importance of time in this context can motivate you to act quickly in the face of a heart attack, whether for yourself or someone else. What happens during a migration? A heart attack occurs when a coronary artery is blocked, preventing blood from reaching the heart muscle. Without oxygen, heart cells begin to die. This process begins in a matter of minutes and worsens over time. The longer the muscle is without oxygen, the larger the damaged area will be, compromising the heart's function. In severe cases, this can lead to death or complications, such as heart failure and fatal arrhythmias. The golden hour. Doctors call the first 60 minutes after the onset of symptoms the golden hour. This is when rapid treatment has the greatest impact, both in saving lives and reducing damage to the heart. For example, procedures such as thrombolysis use of medications to dissolve the clot, or angioplasty, unblocking the artery with a balloon and placing a stent, are more effective when performed quickly. The numbers don't lie. Studies show that approximately 50% of deaths from heart attacks occur within the first hour after the onset of symptoms. This statistic reflects the severity of the situation and the need to act immediately. Furthermore, for every 30 minutes of delay in treatment, the risk of serious complications, such as heart failure, increases considerably. Why not wait? Many people hesitate to seek help, thinking that the pain will go away or that it is not serious. This delay can be fatal. When it comes to a heart attack, the recommendation is clear. Don't wait to see if the symptoms disappear. Call SAMU immediately. How does time influence treatment? If treatment begins quickly, the chances of survival increase dramatically. Additionally, an early start of care reduces the risk of future complications, such as permanent damage to the heart. In the first 30 minutes, damage to the heart is less and treatment success is higher. Between 1 and 2 hours, the damage begins to expand, but there is still time to avoid the worst. After 6 hours, most of the cells in the affected area are already dead, and the complications are much more serious. The importance of immediately recognizing the signs of a heart attack and seeking immediate medical help is the best way to protect your life and minimize damage. As the medical saying goes, time is muscle, and every minute counts to preserve heart function. But it's not enough to act quickly. It is necessary to know what tests and care will be carried out to identify heart problems and prevent future complications. We will explore this in the next topic. What tests should I take to identify heart problems? Preventing a heart attack starts with early diagnosis of heart problems. Often, the heart gives signs that something is not right before an emergency occurs. Having regular checkups helps identify risk factors such as high blood pressure, high cholesterol, or blockages in the arteries, and take preventive measures. Here are the main exams you should consider. 1. Electrocardiogram, ECG. The electrocardiogram is a quick and painless test that records the electrical activity of the heart. It is essential for identifying changes in heart rhythm, signs of a heart attack, or other conditions that affect the functioning of the heart. An ECG can detect problems even if you are not experiencing symptoms at the time of the exam, making it a valuable tool for early diagnosis. 2. Stress test. Also known as an exercise test, this test evaluates how the heart responds to physical effort. It is performed while you walk or run on a treadmill, with continuous monitoring of heart rate, blood pressure, and electrical signals from the heart. Stress testing is especially useful for detecting blockages in the coronary arteries that may not be noticeable at rest. 3. Echocardiogram. Echocardiography uses ultrasound to create images of the heart in motion. It allows you to evaluate the structure and functioning of the heart muscle, valves, and blood flow. This exam is essential to identify conditions such as heart failure, valve problems, or areas of the heart that are not pumping blood properly. 4. Blood tests. Blood tests can provide crucial information about heart health. Key markers include total cholesterol and fractions, LDL and HDL. High levels of LDL, bad cholesterol, and low levels of HDL, good cholesterol, increase the risk of heart attack. Triglycerides. High levels are associated with cardiovascular problems. Troponin. This protein is released into the blood when there is damage to the heart muscle, being an important marker for diagnosing heart attack. 5. Coronary artery tomography. This exam is performed to assess the presence of fatty plaques and calcifications in the arteries. It provides detailed images of the cardiovascular system, helping to detect obstructions that could lead to a heart attack. 6. Holter monitoring. A Holter is a device that records the heart's electrical activity for 24 hours or more while you carry out your daily activities. It is indicated to investigate arrhythmias or other problems that do not appear on a conventional ECG exam. Who should take these exams? If you are over 40 years old or have risk factors such as hypertension, diabetes, high cholesterol, a family history of heart disease, a sedentary lifestyle, or obesity, it is essential to have regular checkups with a cardiologist. Even those who lead a healthy lifestyle should consider these tests, especially if there are symptoms such as palpitations, chest pain, or frequent shortness of breath. The importance of medical support. Early diagnosis can prevent serious complications and save lives. Additionally, your doctor may recommend lifestyle changes, medications, or specific treatments based on test results. Taking care of your heart is an ongoing commitment, and for those who have already identified risks, taking steps to reduce the risk of a heart attack is the essential next step. Let's talk about this in the next topic: how to reduce the risk of a migration. Reducing the risk of a heart attack requires an integrated approach which combines lifestyle changes, control of medical conditions, and regular follow-up with healthcare professionals. The good news is that most heart attacks can be prevented with simple but consistent measures. Here are the most important steps to protect your heart. 1. Maintain a healthy diet. The foundation of a healthy heart is diet. Prioritize foods rich in fiber, such as fruits, vegetables, and whole grains. Include good fats, such as those found in olive oil, avocado, nuts, and fish rich in omega-3, such as salmon and sardines. Avoid ultra-processed foods, rich in sugar, salt, and saturated or trans fats, which increase bad cholesterol, LDL, and contribute to the formation of plaque in the arteries. A balanced diet also helps control weight, one of the critical factors in preventing cardiovascular diseases. 2. Exercise regularly. Physical activity is essential to keep your heart strong and healthy. Aerobic exercises such as walking, running, swimming, or cycling improve blood circulation, help control blood pressure, and reduce bad cholesterol. It is recommended to perform at least 150 minutes of moderate activity per week or 30 minutes per day, 5 times a week. Even small changes like taking the stairs instead of using the elevator make a difference. 3. Avoid smoking and excessive alcohol. Smoking is one of the biggest causes of heart health, as it damages arteries, promotes the accumulation of fatty plaques, and increases the risk of clots. Quitting smoking can reduce the risk of heart attack by up to 50% in just 1 year. Excessive alcohol consumption should also be avoided, as it increases blood pressure and can cause arrhythmias. Keep consumption moderate, up to 1 dose per day for women and 2 for men. 4. Manage stress. Chronic stress is one of the heart's biggest enemies. It stimulates the release of hormones such as adrenaline and cortisol, which overload the cardiovascular system. Include practices that help reduce stress in your routine, such as meditation, yoga, breathing exercises, or relaxing hobbies. Sleeping well is also essential. Sleep deprivation increases the risk of high blood pressure and heart disease. 5. Monitor your health regularly. Control risk factors, such as hypertension, diabetes, and high cholesterol, with medical supervision. Having regular checkups helps identify and treat problems before they develop into something more serious. Taking prescribed medications correctly and following your doctor's instructions are essential steps for those who already have a history of cardiovascular diseases or are in risk groups. The impact of long-term changes. Implementing these changes in your routine not only reduces the risk of heart attack, but also improves your overall quality of life. You will have more energy, and less worries about unexpected emergencies. Remember, prevention is always better than cure. Small steps can have a big impact on the future, and by taking care of your heart, you also inspire others to do the same. Finally, for all of this to be possible, it is important to stay motivated and committed. In the next topic, we will finish with an inspiring message for you to take with you. You are the main career of your heart. Taking care of your heart is more than a health issue. It is an act of self-love and responsibility towards those around you. The heart is the engine that drives your life, and protecting it means ensuring that you are present to experience moments that really matter. Every step you take, whether it's including more healthy foods in your diet, exercising, or giving up bad habits, is a step towards a longer, fuller life. And it's not about perfection, it's about consistency. Small changes, when added together, bring big results. The knowledge you gained today is not just for you, it's also about helping those you love. Recognizing the signs of a heart attack, acting quickly, and avoiding mistakes can save lives. Maybe yours, maybe someone close to you. Now reflect. What can you do today to protect your health? Maybe it's that walk you've always put off, or the decision to schedule a checkup. It doesn't matter the size of the step, but the commitment to taking care of your heart daily. Remember, a healthy heart is not just one that beats strong, but one that is protected by conscious choices. Share this knowledge, spread the importance of taking care of cardiovascular health, and inspire other people to adopt habits that transform their lives. The power to change is in your hands. Take care, live longer, live better.